Good evening, everyone, and welcome to today's wonderful evening with Dr. Pradeep Bharadwaj. So today we'll start with a short quiz. Pick up your smartphones and join the quiz. And after the quiz is over, we will take up our NEETPG mock test 16 live session. So I hope you're all ready, and I think you all know what is the link for the. I am already able to see around 3 players, Ravinder Singh, Kuldeep, and Manu are all online. So please inform your friends also that the live class has started and to join the quiz. And I'm giving you the link over here. Yeah. So you can use this link. You can very much use this link to join on your smartphone into the quiz directly. So let's make the great beginning after. Yes. So you have 20 seconds time for each of these questions. So what is the condition shown is due to the involvement of? So you have the 4 options available. You can punch your answer. Let's see how many of you are right and wrong. Very good. It is the sebaceous gland is what you need to basically remember the condition which is being shown to you. Yeah. So yes. Let's go to the next question. So, what has been shown to you was acne vulgaris is what you need to remember. Very good. Ravinder, Lasya, Ashwin, Kuldeep, excellent. Now, the next question follows. What you are seeing here, it is a complication of what? Is it acne rosacea, acne vulgaris? Does it affect the scalp, or is it a form of dermatofibroma? Hunt your answers, doctor. Yes, it is rhinophyma. Rhinophyma is what you need to remember. And very good. Ravinder and Lasya are on the top of the game. We have Dr. Ashwin and also Kuldeep. Now, the question number 3. So, this is characteristically seen. In which section do you see this characteristically now? Yes. Is it lichen planus, psoriasis, tinea or alopecia areata? So you need to be quite sure. Yes. Very good. It is the pterygium of the nail is what you need to remember. So once more we have Tareen Khan joining the game. Manasir, Fancy Dude, and many more. Good, good. Lasya is on the top. Now, the question number 4. A 16-year-old boy presented with asymptomatic multiple erythematous annular lesions with a coronet of scales at the periphery of the lesions on the trunk. So, my question to all of you is, what is your answer? So, good. Lasya is absolutely right. Oh, sorry. Yeah. Now we go to the question number 5. Yes. A 32-year-old woman presents with a lesion on her left foot. She initially noticed a small bump 6 to 7 months ago that has gradually become firm and slightly pigmented. She has no pain. So what is your diagnosis, doctor? Yes. Very good. 3 said dermatofibroma, 2 said pyogenic granuloma, and it is a dermatofibroma. So what this patient is having a dermatofibroma, which is due to the fibroblast proliferation, is what you need to remember. Very good. So Lasya is on the top with 86 points. Dr. Sam also joined with 52 points. Very good, doctor. Almost 10 of you are participating. I'm very happy. So quiz is the fast way. Tomorrow's NEETPG, they're giving 40 questions as one set of questions. So you should make the practice of the 40 questions as one set. So what is this diagnostic of? Primary or secondary melasma or drug-induced purpura? So what is your answer, doctor? It is pinch purpura is what you need to remember. So, very good. So, Ravinder Singh is on the top, followed by Kuldeep. Lasya is slightly lagging behind, right? Very good. Now, question number 7. A patient gives history of recurrent oral ulcers, as what you can see here. He also has multiple tender nodules on the shield. What is the probable diagnosis is the question to all of you. Very nice to see 9+ online classmates. Very good. Muhammad Mansir Hussain. So, recurrent oral ulcers is Behçet's syndrome. A lot of you, almost 7 of you correctly answered. Very good, doctor. These ulcers are small with a yellow floor surrounded by erythematous halo. Behçet's is very much the correct answer. So Ravinder Singh is on the top, followed by Kuldeep, Dr. Sam, Lasya, Manazir, Fancy Dude, Gayatri, Shivani, Ashwin, Rajesh Raj, John Sabila, Tareen Khan, and many more who are all online. Good, doctor. Good. Very good. Now, the next question, number 8. A 4-year-old child with high-grade fever develops toxic eruptions on the trunk, proximal extremities, bilateral bulbar conjunctivitis without discharge and fissuring, crusting, red lips. So what is your diagnosis, doctor? Very good. So we have 13 online classmates. 6 of you committed it as Kawasaki. Absolutely. Very good, doctor. So Manu rises up, followed by Ravinder, Dr. Kuldeep, Gayatri, Manasi, Lasya, John Sabila, and Shivani. Very good, doctor. So question number 9. Very good. The histopathology which you are seeing here. So where do you see this kind of a histopathology is the question to all of you. So where do you see this kind of histopathology? Punch your answers, doctor. NEETPG, 40 questions are going to be asked. Yes. It is called non-specific lymphadenitis of Kikuchi is what you need to remember. It is necrotizing non-specific lymphadenitis of Kikuchi. So none of you could be able to point out. So the following lesion, which are seen here, typically seen in all these conditions. So what do you have here? Paniculitis is also called erythroderma. So where do you see that? Good, doctor. Chronic pancreatitis, except chronic pancreatitis. So it is fundamentally erythema nodosum is what you need to remember. Good. Manu, Kuldeep, Gayatri, Manasir, Fancy Dude, most of you answered it correctly. Now comes question number 11. Recurrent erythematous plaques on the glans penis in a 19-year-old sexually active who deals with residual hyperpigmentation. What does it suggest, doctor? Yes, punch your answers. Very good to see 12 online classmates to join this quiz. So it is a fixed drug eruption. Only one person answered this correctly. Only one of you out of 13 students who are completing the test answered it correctly. So who is that? One person. Ravinder Singh Jindabad. Very good. Only Ravinder answered it correctly. Nobody else answered. No worries. These lesions, which are able to see, where do you see these lesions, doctor? These lesions, where do we see? 12 online classmates. Very good. 10 of you answered it. Good. These lesions are seen in borderline tuberculoid leprosy Only 4 of you correctly answered. The lesions you are seeing are called satellite lesions, is what you should remember. So you can see Manazir, Ravinder, Dr. Sam, John Sabila, all of you answered it correctly. Very good. Now, question number 13 of 23. Where do you see these lesions? The lesions you are seeing here. Where do you see these lesions? Come on, punch your answers, doctor. Punch your answers. Good. So, borderline BB leprosy. Only one person answered it correctly. So, multiple erythemas, dry plaques, some of them will show a hallmark annular morphology with a punched out inner edge. What is that called? Swiss cheese appearance is characteristic of BB type of leprosy, is what you have to basically remember. So, Jogita Uhi Sikandar. Very good. Our fancy dude is the only guy who answered it correctly. Give it up, fancy dude. Now, question number 14. These lesions, where do you see these lesions? Is it BB, BT, BL, or LL type of leprosy? The leprosy, Hansen's disease. What is the classification? How do you recognize? And remember, in the tomorrow's exam is very, very important, doctor. Very good. So it is the BT leprosy is what you need to remember. 4 of you correctly answered. BT leprosy में क्या होता है? Hypopigmented, hypoaesthetic, dry plaque with a well-defined outer border and loss of appendages. Enlarged greater auricular nerve can be observed on the neck. Whereas BT leprosy में hypopigmented to coppery brown, hypoaesthetic, dry patch with a decreased hair density. That's what you need to remember. Good. So Manazir correctly answered. Sam also has luck on this question. Gayatri also answered correctly. Even Akhil Gopal also answered it correctly. Now, the question number 15. This lesion, where do you see, doctor? Yes. So, you need to be very sure. Only 3 of you correctly answered. 9 only remained in the game. Come on. Very good. It is the BL type of leprosy. Only 3 of you correctly answered. Most of you thought it is lepromatics. Multiple well-defined dry plaques with decreased appendages, symmetrical lesions is BL type of leprosy. Good. So Ravinder is right. Fancy dude is also right. John Sabila correctly answered. Right? Very good. Now, doctor. Question number 16. So the following lesion, where do you see? Is it a lepra reaction or lepromatous leprosy or BB type of leprosy? Good. It is a type 1 lepra reaction. Only 2 of you correctly answered. The pre-existing lesions become more erythematous, indurated, shiny. That is how you identify type 1 leprosy. So who is that? Only one person who answered correct? Kuldeep. Wonderful, Kuldeep. You have done great. Now, where do you see this kind of a leonine faces? Yes, I think most of you will correctly answer. Very, very, very easy question. Yes, good. Out of the 9, only 7 answered. Quickly punch. 8 of you answered. Only one person answered it as lepromatous leprosy with a leonine faces. Most of you thought it is type 2. Right, doctor? Diffuse infiltration of the skin. Nodulation of the ear. Thickening, infiltration. That is how you will identify. Only Gayatri did great. Wonderful, Gayatri. Now, doctor, 18 of 23. So where do you see this lesion? Classically, there is a metarosis also. Now, 11 of you are online. Good. Happy to see. 5 of you answered. Good. Good. It is another example of lepromatous leprosy. Lepromatous leprosy. So, Gayatri, Manasir reached on to the top. So we have 17 players in the game, right, Doc? Saujanya, Rajesh, Tareen Khan, Shivani, Akhil Gopal, and many more. Very good. So every day before we start discussion, let us have 20 questions. So what do you see here? This kind of a reaction is seen because of which drug reaction is the question. Come on now. You have to answer this correctly. Tomorrow, straight away, ditto, same question is going to come. Yes? Very good. So, it is the clofazimine. Only 2 of you correctly answered. Dry plate-like ichthyotic scales, just like the skin of the fish, is observed on the lower legs on treatment. Very good. Gayatri is on the top. Very good, Gayatri. Followed by Manasir, Ravinder, Fancy Dude, Kuldeep, John Sabila, and many more. Now, question number 20 out of 23. Come on, punch your answer, doctor. So where do you see this lesion? Is it hystoid, borderline tuberculoid, borderline lepromatous, or BB type of leprosy? Come on. Gentlemen, today I took you on a storm of leprosy. Tomorrow NEETPG question aega. It is hystoid type of leprosy. Histopathologically, it appears like hystoid lesions where histiocytes, they form an interlacing band, cuticles, and hodles. So once more, Gayatri is rocking the longest streak, and she makes it to the top of the game. Come on, Ravinder, Sam, and Manasir. 21. So where do you see the following lesion? Is it hystoid, borderline, tuberculoid, or tuberculoid TT type? Yes, 9 of you are online. Come on, punch your answers, doctor. Very good. Excellent. It is PT, well-defined erythematous, hairless, dry anesthetic plaque. Wow. Once more, Gayatri gains onto the top of the game. Then 22. So where do you see this lesion? What type of leprosy do you see this lesion, doctor? Yes, punch your answer. Is it BB, PT, BT or hystoid? Very good. Only two of you identified it is BT, hypopigmented hypoesthetic dry patch with loss of appendages, maculoanesthetic patches. John Sabila had a, and Rajesh Raj, only two of you correctly answered. The last question of the today's evening in the leprosy quiz, one question is going to come in tomorrow's exam. So what is this type of leprosy lesion? Could you give me the correct answer, doctor? The last question for today's evening. Nice to see 10 online classmates on the YouTube. Very good. After this is over, we will take up the NEETPG mock test number 16. Very good. Indeterminate leprosy. 6 of you correctly answered. Excellent, doctor. Now, the final scoreboard where Gayatri wins. Gayatri is the winner. Very good. With 761 points. Congratulations, Gayatri, Manasir, Sam, Ravinder, and many more who all have participated in today's wonderful evening, doctor. So, we come back to the regular class of NEETPG mock test 16 live discussion. Good. Can the online students can punch? Is the voice loud and clear for all of you, doctor? Can the online students can punch? Is the voice loud and clear for all? Yes. Thanks for joining. Yesterday and day before yesterday, I could not make it. I was not keeping well. So today I'm a little better, but still my voice has that common cold nasal tinge. It doesn't matter. Very good. Thank you, Ravinder and everybody, Mohammed, Manazir and everyone for joining the session. So let's start the game, doctor. Yes. Now, a patient with severe lower abdominal pain and fever. So what can you see on imaging, doctor? So you can see fluid collection with the gas formation in the sigmoid colon area, right? On the CT is highly suggestive of diverticular abscess, particularly in a patient who has got pain and fever, is what you need to remember. Now, A patient presents with a tongue deviation upon protrusion, and the tongue is deviated towards the left, is typically left hypoglossal nerve. Weakness or paralysis of the tongue muscles on the left side causes it to deviate towards the same ipsilateral to the affected side will be the deviation in hypoglossal nerve palsy is what you should remember. A patient has a well demarcated tan colored lesions on the back. This has a waxy and slightly shiny appearance. It has a smooth texture and is not tender to touch. What is your diagnosis, doctor? Well demarcated, tan colored, waxy, shiny appearance fits the profile of seborrheic keratosis. They have got a stuck on appearance as such. You have stuck on little dung onto the body is what you need to remember. A patient presents with a guide which is being shown to you. Unilateral arm immobilization. Leg is gone into extension and there is a circumduction which you can see, the circumduction while walking. So what is this basically called as? Spastic hemiparesis. Whenever there is any cerebrovascular accident, stroke is there, then you will see this kind of lesion is what you need to remember. A patient presents with the hair loss on the scalp. What is the most likely diagnosis? Alopecia areata, where you can see coin-shaped discrete patches of hair loss along with exclamation marks are the hallmark of alopecia areata, which is largely autoimmune in nature. Patient has asymptomatic lesions on the back of the hand composed of skin-colored bumps. So this fits into granuloma annulare, where ring-shaped, smooth, firm papules are there. Right? So that is what you need to remember. Now, a patient with several lesions like this on the wrist, they are being shown. So itchy purple flat-topped papules with white lines called Wickham striae. These are characteristic of lichen planus is what you have to remember. A patient with a neurological condition, reduced arm swing, shuffling gait, classical of Parkinson's disease is what you should remember. Very nice to see 10 online classmates for NEETPG mock test 16 live discussion. So totally there are 50 full-scale NEETPG mock tests, doctor. Today is May 14th. Still we have 35 days time left. Let us work out the best. So, muscle weakness, erythematous bumps on the hands known as Gottron's papules with specific nail changes like ragged cuticles and abnormal capillary loops is indicative of dermatomyositis is what you need to basically remember. A supine abdominal radiograph, concentric rings of fluid collected. So, what is that called? Plicae circulates, which are the normal anatomical feature. This kind of circular loops of fluid is typically the feature of small intestine is what you should remember. A patient has a well demarcated lesion like this. Their wooden stick, you have done a gentle scraping and it shows the shiny lesion, which is very characteristic of psoriasis It's called auspit sign is what you should remember. Auspit sign. During a physical examination, right? Push down your right heel, weak hip extension. Lift your leg, the hip extension returns to normal. So that clearly shows the right leg weakness is non-organic is what you need to remember. What is this called? Hoover's sign. Hoover's sign. Involuntary muscle movements are consistent and cannot be suppressed by the patient. That's what you detect in a Hoover's sign. So typically Hoover's sign is positive when there is no counter pressure from the non-affected leg while the patient attempts to raise the affected leg. That's called Hoover's sign. The patient is having stock and glove distribution. Stock and glove distribution, which is typically seen in length-dependent peripheral neuropathy. So what do you see here, doctor? Patient presents with this pattern. Light touch on one side, pain and temperature on the other side, pyramidal weakness, right? And increased tendon reflexes in the left leg. So this is a classical story of hemisection of the spinal cord. In this case, it is on the left side, right? It is on the left side. So it is left brown sequard syndrome is what you have to remember, doctor. The patient presents with the numbness in the pattern shown here. Abductor pollicis brevis opponens pollicis are affected, which is very typical of median nerve lesion. The patient with muscle weakness has this kind of telangiectasis in the nail fold, which is the characteristic feature of dermatomyositis, is what you should remember. Now, a patient undergoes an endoscopy. So actually Crohn's disease has been shown. Here the image is missing, but Crohn's disease is the one. The patient has the symptoms of acute abdominal pain. What is this called? Whirl sign. As such, there is a tornado which is having a whirl. So whirlwind-like appearance is a feature of small bowel volvulus. Classically, will show this kind of a wind sign is what you should remember. Now, if you look at here, doctor, typically there is a sensory loss and the finger extensors, thumb extensors, wrist extensors and brachioradialis, all of them are involved, which is classical of radial nerve lesion is what you should remember. And this area is called anatomical snuff box. Typically in the anatomical snuff box, whenever there is any sensory loss, you will think of only one condition, which is radial nerve palsy is what you should remember. Right, doctor? Yes. Radial nerve palsy. Yeah. A patient presents with Abdominal distension, pain. So what can you see? Distended transverse colon with air fluid levels, and the descending colon is collapsed, suggests that there is an obstruction, characteristically a colonic obstruction secondary to carcinoma on the splenic flexure is what you need to remember. The patient presents with a left lower quadrant abdominal pain, low-grade fever, tenderness. CT scan shows. What does it show? Colonic thickening, localized inflammation of the left lower quadrant. It is an acute sigmoid diverticulitis. It is also called left-sided appendicitis is the name given whenever the sigmoid diverticulitis develops. The patient has a progressive pain in the left thigh. There is a vascular mass in the thigh. Such a vascular mass-like presentation is characteristically seen with the osteogenic sarcoma. The patient has a lesion in the fingers, swelling of the lower limbs, history of repeated fluid accumulation in the chest. This is called yellow nail syndrome, where there is a lymphedema, recurrent pleural effusions in case of yellow nail syndrome. So in just one mind map, you will get the entire picture, doctor. So today only visit learnograph.com, and there you can download the PDF of the question paper with the 200 mind maps of explanatory answers. You can solve the paper, share it with your friends, and make a discussion. A patient presents with this kind of a sensory loss, toe dorsiflexors, foot dorsiflexors, foot everters, all of them are affected. Typically in common peroneal nerve lesion, presents with a foot drop, high stepping gait, sensory loss on the dorsal aspect of the foot, which are all indicative of common peroneal lesion. The patient has a burning pain, tingling sense, without any muscle weakness. So this is typical of meralgia paresthetica, where the lateral cutaneous nerve is the one which is affected. There is no area that it supplies motor. That's the reason it will be pure sensory loss is meralgia paresthetica. 74-year-old with anemia, severe back pain, high ESR, creatinine 2.8, that means there is a renal failure. Multiple punched out lytic lesions in the skull is equal to multiple myeloma. Now, a patient undergoes MRI, experiencing a sudden visual disturbance. So what do you see here? Hyperintense lesions are seen in the occipital area in both hemispheres. That means it's an ischemic stroke. So that lead to, you have the visual cortex in the occipital area. That's the reason there is a visual disturbance. This patient has a sudden severe headache and loss of consciousness. And what do you see here? Filling of the blood in the typically sylvian fissures. Normally, on a plain CT, you don't find opacification of the sylvian fissure. If it is there, that means there is a subarachnoid hemorrhage and there is also development of hydrocephalus because of the increased width of the occipital horns. Patient has a new onset seizures and headache, ring enhancing lesion with a hypodense core is very much indicative of cerebral abscess is what you need to remember. A patient has a recurrent abdominal pain with bloating. Radiographic imaging is being shown. So this is chronic partial small bowel obstruction. There's a dense material in the ileum resembling the fecal matter. with a normal appearing jejunum, which is very characteristic of small bowel fecalization. It is called as, which is due to chronic small bowel obstruction in conditions like Crohn's disease. Patient has history of visual disturbances, intermittent numbness. MRI shows periventricular lesions in the T2 weighted MRI, characteristic of multiple sclerosis. Patient has history of significant weight loss due to chronic illness, nausea, vomiting, inability to tolerate the solid foods. So there is a distended stomach and a duodenum. Both of them are distended with compression of the duodenum between the superior mesenteric artery and the aorta. Okay, along with the gastric outlet obstruction. What is this called? Superior mesenteric artery syndrome is what you need to remember. I leave the literature for you. Everything, anything in one mind map, you get everything, the high yield points. So once more, let me tell you, every NEETPG may image-based questions. Almost you will have 50 to 60 image-based questions. You must be ready on most of the high yield topics, how to answer these image-based questions. Remaining 150 will be clinical minute-based questions. Just like the examiner, we also give 50 full-scale grant tests, each containing 200 questions. Every question is followed by an explanatory answer in the form of a mind map. And I will be there to discuss with you at least 50, 60 questions so that you get that upstroke for kick-starting your habit of answering the question paper. A patient has an intense nocturnal itching and visible thread-like lines on the wrist, characteristic of burrows, which are seen with sarcoptis scabies. That's the reason this is scabies. A 78-year-old with gradually worsening loss of smell and intermittent headache. CT scan is being shown. What is this? Olfactory groove meningioma is the presenting feature. Right, doctor? Now, patient has a persistent low back pain radiating to the left leg. T2 weighted image is being shown. So it is a herniated disc at the L4, L5. Because on the T2 MRI, there is a hyperintensity which is indicative of the intervertebral disc prolapse. The patient has got a difficulty to focus the objects close and has been having eye strain. So this is hypermetropia, the long-sightedness. Bigger the size of the globe, you get myopia. Smaller the size of the globe, you get the hypermetropia, is what you need to remember. Hypermetropia में क्या होता है doctor? The focus will fall behind and you will use the biconvex lens in order to correct hypermetropia. Now, patient has the inability to open the right eyelid. Ptosis is there. Ocular examination is being shown to you. So this is an example of a right oculomotor nerve palsy. So whenever there is any pupillary dilatation, eye is in abducted position, there is a presence of the ptosis. So pupil sparing oculomotor nerve palsy occur kahan? Diabetes, hypertension, like medical conditions. Pupil dilated with the ptosis kind of oculomotor palsy kahan? Whenever the cause is surgical, like aneurysm of the posterior communicating artery is what you need to remember. A patient reports sudden monocular vision loss. You get it in compressive optic neuropathy. The patient presents with a progressive abdominal distension. what is this called ladder-like pattern with distended loops, which is typical of distal small bowel obstruction, is what you need to remember. So this is the kind of visual field defect which typically occur. This is called upper quadrant anopia, which occur whenever upper quadrant anopia occur whenever there is any temporal lobe lesion. So everything, anything about the various visual field defects, you need to be very, very sure about that. So that brings us to the end of the today's discussion, doctor. Remaining 160 questions, you have very clearly explained explanatory answers. 160 mind maps are there, which you need to do the revision quickly and get ready. So tomorrow we will take NEETPG mock test paper 17 discussion. रोज एक पेपर खत्म करेंगे. टोटल 50 क्वेश्चन पेपर्स को NEETPG मॉक टेस्ट को सॉल्व करेंगे. ई बुक पीडीएफ डाउनलोड करना, ऐप का टेंशन नहीं है, ऑनलाइन का टेंशन नहीं है. आपके लैपटॉप में ही क्वेश्चन पेपर आके गिरेगा. 2-3 साथियों को बिठाओ, उनको भी शेयर करो फ्री में, कोई बात नहीं, राइट? आपस में डिस्कस करो और सॉल्व करो. दैट इज मोस्ट इंपॉर्टेंट. एंड एवरी माइंड मैप में आपको पूरा डिस्कशन हो जाएगा. So this is Dr. Murli Bharadwaj, your everyday classmate, roommate, benchmate, and table mate for the NEETPG preparation. Thank you.